Did you know that prostate cancer is one of the most common cancers in men? It affects millions of men worldwide and is the second most common cause of cancer-related deaths in men in the United States. But don't worry, in this video, we'll be discussing the 8 warning signs of prostate cancer, how to lower your risk, and what you can do if you think you might have it. So, if you're a man or have a man in your life, you don't want to miss this video. Let's get started. Understanding prostate cancer. To understand prostate cancer, we need to know what the prostate is. The prostate is a small gland located between the bladder and the penis in man. It produces seminal fluid that nourishes and transports sperm. Prostate cancer occurs when the cells in the prostate gland start to grow uncontrollably. This abnormal growth can spread to other parts of the body and can be fatal if not detected early. There are several factors that can increase the risk of developing prostate cancer. These include age, family history, ethnicity, and lifestyle factors such as smoking, obesity, and lack of physical activity. While prostate cancer is more common in older men, younger men can also be affected. 1. Urinary symptoms. Urinary symptoms are some of the most common signs of prostate cancer. If you experience any of the following urinary symptoms, it is important to get checked by a doctor. A weak urine stream, the need to urinate more often, especially at night, difficulty starting urination or a delay in urination, pain or a burning sensation during urination. 2. Sexual symptoms. Prostate cancer can also affect a man's sexual health. Some sexual symptoms associated with prostate cancer include erectile dysfunction or impotence, pain during ejaculation, decreased sexual desire. 3. Pain symptoms. Prostate cancer can cause various pain symptoms that can be very uncomfortable for patients. Here are some of the pain symptoms associated with prostate cancer. Pain or discomfort in a sitting position, deep pain or stiffness in bones, pain in the back or hips, pain in the pelvic area, pain during bowel movements. 4. Blood symptoms. Prostate cancer can lead to blood-related symptoms such as blood in the urine or blood in the semen. The prostate gland is located close to the bladder and urethra, which are responsible for the removal of waste products from the body. As prostate cancer grows, it can interfere with the normal function of these organs and cause bleeding. Blood in the urine, also known as hematuria, occurs when cancer cells invade the prostate gland and damage the blood vessels. This can cause blood to leak into the urine and result in a red or pink color. Blood in the semen, also known as hematospermia, occurs when cancer cells invade the prostate gland and damage the blood vessels that supply blood to the seminal vesicles. The seminal vesicles are responsible for producing semen, and bleeding in this area can lead to the presence of blood and semen. Other symptoms. Apart from the symptoms mentioned earlier, there are other warning signs that could indicate the presence of prostate cancer. Let's look at a few. 5. Unexplained weight loss and fatigue. Prostate cancer cells can consume the body's energy supply, leading to unintended weight loss and fatigue. The tumor can also produce substances that cause the body to break down muscle and fat tissue, further contributing to weight loss. 6. Numbness or weakness in the legs or feet. As prostate cancer advances, it can spread to the bones and cause pressure on the spinal cord and nerves. This pressure can lead to numbness or weakness in the legs or feet. 7. Swelling in the legs or pelvic area. Prostate cancer can cause swelling in the legs or pelvic area. This swelling occurs when the cancerous cells obstruct lymphatic vessels, which are responsible for draining excess fluid from tissues. 8. Numbness or weakness in the legs or feet. Similar to the previous point, prostate cancer can cause numbness or weakness in the legs or feet due to the cancer spreading to the bones and putting pressure on the spinal cord and nerves. It's essential to be aware of these symptoms, but keep in mind that they can also be caused by other conditions. If you experience any of these symptoms, it's important to discuss them with a doctor to determine the underlying cause. Screening and diagnosis. Early detection of prostate cancer can increase the chances of successful treatment. Screening tests for prostate cancer include digital rectal exam (DRE). During a DRE, a healthcare provider inserts a gloved and lubricated finger into the rectum to feel for any abnormalities in the prostate. Prostate-specific antigen PSA test. A PSA test measures the level of PSA, a protein produced by the prostate in the blood. Elevated levels of PSA may indicate the presence of prostate cancer. Biopsy. If the DRE or PSA test results suggest the presence of prostate cancer, a biopsy may be necessary to confirm the diagnosis. During a biopsy, a small piece of tissue is removed from the prostate and examined under a microscope. Treatment options. If you or someone you know has been diagnosed with prostate cancer, it's important to know that there are several treatment options available. The best course of treatment depends on the stage and severity of the cancer, as well as the overall health of the patient. Here are some of the most common treatment options. Fluxactive. Fluxactive is conveniently packed with over 14 essential prostate powerhouse herbs, vitamins, and grade A nutrients which work together to help you support a healthy prostate faster. Check the pinned comment or the description to learn more about Fluxactive. Watchful waiting or active surveillance. This approach involves monitoring the cancer closely but not treating it immediately. This is often a good option for older men with slow-growing cancers that are unlikely to cause problems in their lifetime. Surgery. The most common surgical option is a radical prostatectomy, which involves removing the entire prostate gland. This can be done either through traditional open surgery or minimally invasive robotic surgery. Radiation therapy. This treatment uses high-energy rays to kill cancer cells. It can be delivered externally through a machine that directs the radiation at the cancer, or internally by placing radioactive material directly into the prostate. Hormone therapy. This treatment blocks the production or effects of male hormones that can stimulate the growth of prostate cancer. Chemotherapy. This treatment uses drugs to kill cancer cells. It is typically used in advanced cases of prostate cancer that have spread to other parts of the body. Conclusion. Prostate cancer is a serious disease that affects millions of men every year. But with early detection and proper treatment, many men are able to survive and even thrive after a prostate cancer diagnosis. Remember to pay attention to your body and talk to your doctor if you notice any of the warning signs we discussed in this video. And if you found this video helpful, please give it a thumbs up and subscribe to our channel for more informative content on health. Thanks for watching.